Hi guys, I got a really challenging question today. I will do my best to answer it. I don't know that I have all the answers for it, but here we go. So today's listener submitted question was, how do I help my pet with separation anxiety when my kids go back to school? That is a head scratcher. Really good question. I don't know that I have all the answers, but I can give you some suggestions to try and then work your way up the ladder. Talk to your local vet, go from there. So, challenging question. So, basically, this is a behavior problem, and generally, we'll kind of want to lean towards behavior modification. So, if you can identify the problem, in this case, kids are home over summer and then all of a sudden going back to school, per the pet's perspective. How do you ease that transition? Anytime we're dealing with a behavior modification, it's usually in baby steps. So first, identify the problem. In this case, kind of easy to do. Second is, how do we minimize that reaction or that response, aka the anxiety response? So baby steps. So ideally, and I don't know how feasible this is for everybody, extrapolate. But say it takes about an hour before the patient gets to that point of anxiety of missing the kids and things like that. The reality is they should be in and out of the house randomly throughout the summer anyway, to go to practices, go to school, go to practices, the grocery store, go to the movies, go to a friend's house. They're usually leaving at some point in time. They're not attached at the hip 24 hours a day, 7 days a week. That's just not realistic. Not healthy either. So baby steps. Find that timeline. Is it take 20 minutes before the patient develops anxiety away from the kid, or 30 minutes, an hour, 5 hours? What is it? Find your threshold, find your constant, and then work backwards. Say it's 1 hour, okay? We're gonna start with 30-minute increments of here you go, and then baby step, separate us, and then they come back. Probably use one hand signal or one gesture or get a bell and ding it, something, and then try and redirect that behavior so that when they're with the kid, they get this, frozen Kong toy, frozen with peanut butter, something like that. And then, okay, you take that away, then you go 45 minutes. And then after another couple days, then you get to the hour and so on and so forth. Now, be careful with that because peanut butter is high in calories. But make sure you're conditioning the right behavior. Sometimes owners will do this and they condition an unintended behavior. Be mindful of it, just pay attention to it. So try baby steps. The good news is most patients will adjust after a couple days, weeks. A few patients will go a couple months. In my opinion, if they're still having issues after 60, 90 days, whether it's from passing of a loved one, the caretaker, somebody moved because they couldn't take care of him anymore. In this case, kids are going back to school and that was their play buddy. So if it gets past about 60, 90 days, that is where I do think it's a good idea to touch base with your veterinarian, and then we kind of visit the pharmaceutical side, because some patients do need medical intervention to help ease the anxiety and the stress. For most patients, more so, what are the red flags that I want you to look for at home? If they're getting really destructive, whether it's self-mutilating, destroying doors, drywall, things that they didn't used to destroy, that's your red flag for, hey, we really need to prioritize this and pay attention. And then if needed, go see your veterinarian and, go from there. So thanks for the question, guys. Sorry, that was a really hard one for me to answer, but wanted to take on the challenge and just kind of see how it went. So thanks again. You guys have a great rest of your day.